Sure. Yeah. So, Chris, today we're talking about anesthesia errors, medical malpractice. We hear about anesthesia errors sometimes in the news, but how common are they in terms of medical malpractice cases?
In terms of medical malpractice cases, they're probably one of the most common types of malpractice cases.
And can you describe, like, what we're talking about when we say, an anesthesia error?
Well, I mean, simply it's any error made by an anesthesiologist. I mean, most commonly they happen during surgeries, but uh, the more more different types of anesthesia that are being used today for simple procedures. Like conscious sedation is one of them. Where you're kind of put in a twilight. People refer to it as so.
Right. You're sort of still half awake, but not really conscious of what's going on.
Right, right. But then there's the traditional old fashioned where you get wheeled into the operating room and you're put to sleep during quote unquote put to sleep during the time that the surgery is going on, and then you're awakened at the end of the surgery and then taken into recovery. So
So what are some of the mistakes that anesthesiologists can make that might qualify as medical malpractice?
well, I mean, the short answer to that is any kind of error that results in an injury to the patient. Uh, I guess going back to what we were talking about before, when in terms of like outpatient procedures, when the twilight is used, the most common thing that happens there is that um, that's a form of anesthesia, but it's not very frequently used. There's not an anesthesiologist there that's performing the anesthesia. So, doctors, if they have certain training, are allowed to do that. Um, Nurse anesthetists are allowed to do that. Sometimes, doctors would delegate that anesthesia to one of their nurses who aren't qualified, that are supposedly doing under the doctor's supervision. But so with conscious sedation, what happens is sometimes the person doing it will put the person in too deep of a sleep. The reason it's allowed to be done in outpatient settings without an anesthesiologist is the person's not supposed to be put to that deep of a level of sedation. So that's the most common, like in an outpatient setting, is the person either having a reaction to the drugs that are used for sedation, and the people that are there aren't qualified or to reverse it, or if they don't have the reversal agents available, and the same can be true, in an inpatient in a operation. But what most people don't realize is, and I didn't realize this when I started doing it until I had the first few anesthesia cases, is that the anesthesia is that they give you drugs that actually make you stop breathing, and the anesthesiologist takes over, breathes, breathes for you. You can have machines that breathe for you, that put you on a ventilator, that breathes for you. But basically, when you're put under, your life is literally in the hands of the anesthesiologist, and it's up to them, to make sure that you're breathing and that your heart's beating, because those are the two things that keep you alive, keep you going. So anything that they do that interferes with that. So the problem is, these are pretty potent drugs, as you can imagine, and every patient's body reacts differently to them. So they can get a certain drug and their heart could stop beating, or they could stop breathing, or it could drop their blood pressure, or it can make their heart start beating faster, or it can raise their blood pressure. So anesthesiologists are trained to react to all of those, different variances. But, again, there could be situations where they don't react fast enough, they don't notice it. So in an inpatient setting, the biggest, most common thing that happens is that, there's hospitals have what are called operating suites, which will have 8 operating rooms in a suite. So there'll be 8 surgeries going on at the same time. hospitals, to save money, will have one or two anesthesiologists, the anesthesia doctors that are assigned to this operating suite on a given day. And then there's anesthesia assistants or nurse anesthetists that are actually the ones administering the anesthesia. So it's all delegating down, and you're not necessarily having an anesthesia doctor. They're required to be there at the time you're put to sleep and at the time you're awakened. So we had a pretty tragic case where a woman went in just for simple surgery on her nose. She had deviated septum, and the anesthesiologist wasn't there at the time of bringing the person out of the anesthesia. It was a resident who was doing it, didn't do it properly, and she got over sedated and ended up with a brain injury from that, and was in a permanent vegetative state the rest of her life just from a simple surgery for deviated septum.
Yeah, I was going to ask what some of the long-term, consequences might be, beyond just the surgery itself, and issues there, like you said, things like your heart stopping or beating too fast or your breathing or, having issues like that. What are some of those long-term consequences like brain injuries that might happen because of problems with anesthesia?
Well, sure, these are the most dangerous, types of malpractice cases because, what I just said about the drugs and stopping your, affecting your heart rate and affecting your breathing. So, anytime your heart stops beating, you get a loss of blood flow to your vital organs, particularly the brain. That can cause a brain injury, which is what happened to our client that I just mentioned. So, if you're the same thing, you stop breathing, you're not getting enough oxygen. It's also, brain injury and death are the two biggest things.
So if someone believes that they've been harmed or that a loved one, has been harmed by an anesthesia error, what are the steps that they should take to investigate this and potentially pursue a lawsuit?
Well, this actually is a particular type of malpractice. Unless you have a friend who's an anesthesiologist, you're going to need to consult with a medical malpractice lawyer, because every surgery or every time there's anesthesia used, there has to be a record kept of the anesthesia, and that record is second by second, minute by minute. So it has to document what drugs they gave, what time they gave them, what the patient's heart rate was before and after they gave the drug, and all during the procedure. So that the anesthesia record, you need to get that, and you need to have somebody who knows what they're looking at, kind of go through that record second by second and figure out what happened, where the error occurred, or what could have been done to prevent the injuries.
And then what types of damages might be recoverable in a medical malpractice lawsuit due to an anesthesia error?
Well, there's two types of damages you can recover in medical negligence cases. One, anything for future medical care, lost wages, any kind of money losses that result from the injuries. So if you have a brain injury and are never able to return to work, you can recover, lost wages through your retirement age. Any treatment you'll need in the future, or for people with serious brain injuries that need round-the-clock care, all of that, you can recover in a malpractice suit. You can also recover for, non-money losses, which are for pain, suffering, everything, that a person goes through, that you can't put a dollar value on. It doesn't have a price tag on it. If it results in death, then the family of the patient can recover for their, loss of support, loss of companionship or being with the person, and mental anguish from going through that